Good evening. You're most welcome to Hope Hills, where we bond journey into life. Imagine losing a loved one, not because the treatment didn't exist, but because the system failed before the doctor couldn't even act. Today at Hope Hills, we meet a young African founder using AI and smart health technology to fight one continent's deadliest invisible problem. Welcome to our platform. Can you kindly introduce yourself?
Thank you very much. My name is Goodluck, and I'm a student at the African Leadership University here in Rwanda. That means I'm based here. And I'm the founder and CEO of HayoHealth,
Wow,
a health tech startup.
yeah,
Thank you.
you're most welcome.
Yeah.
Now, I heard you say Hayo Health. Before we talked about that, I would like to know what is your personal experience. You lose one relative, a friend, or a relative child due to delayed information during an emergency delivery. And also, you face the same issues healthcare here in Rwanda. How does experience shape your decision to build higher health?
All right. Thank you for that question. Yes, I did lose a family friend. No, not the
Yeah.
family friend, but the baby of our family
Oh,
friend.
sorry.
And coming here to Rwanda, I was using, an insurance, but unfortunately, my insurance got expired.
Mhm.
I had to do so many tests. I wasn't feeling well that day. I had a very serious allergy. I was weak. Like it took so much time for them to get my previous tests because I needed to go to the nearest hospital. And with all of that, you can see there's a huge problem in that. And it made me now started
Yeah.
thinking, oh, this was the same problem that my aunt passed through, and it's still something that still happens here in Rwanda.
Mm-hmm.
And it shows how it continues to happen in so many African countries. And so far, thinking of everything, I would say pain actually shaped me, but hope actually is what kept me going. Thank you.
Oh, you're welcome.
Yeah.
You realize that hospitals cannot access to patient medical record,
Yeah.
and they force patient to repeat the test, wasting time and also spending more money. Okay. Why does why does how does big that problem is in Africa, and what do you think that problem have been doing for a long time?
All right, thank you so much. So, how big that problem is that over 70% of African health facilities still operate in a siloed system, meaning that they they store patient records,
Mm-hmm.
every information and details of that patient, including their claims on
Yeah.
papers. And because they store it on papers, when a patient that visits hospital A
Mm-hmm.
goes to hospital B, their records cannot be accessed.
Yeah,
And
exactly.
everything happens in a different system, in a different method.
Yeah.
And would you believe that over 1.5 billion patients in the continent,
Mm-hmm.
Africa,
Mm-hmm.
benefit or that problem actually impacts on, right?
I understand.
And yeah, I think that's your question. So that's how big the problem actually is.
No, many people believe that health health care crisis is maintained
Yeah.
about lack of hospital or doctors. But you believe that technology and that fragmentation
Yeah.
are also among those problems.
Yeah.
Can you explain us a little bit about that?
That's a very good question. I wasn't even expecting to get that. So the truth is, I'm honestly not arguing with that, but I would also love to drop or say that over decades we've been hearing that, this country is pumping money in hospitals, in healthcare,
Yes.
to more doctors, ensuring that there are more doctors and
Yeah.
everything. But in a case where the best doctor is being given the job, and then a patient with a severe issue comes to the hospital, and then the doctor cannot access that
Yeah.
patient's information, then what's the point?
Exactly.
We need to ask ourselves the question of what's still missing, because even with those best doctors, there are still so many things that leads to human or patient death that could be preventable, right? So information matters in as much as those doctors still matters. And now we are in the world of AI where it can actually save a lot.
Yeah,
So
exactly.
why can't we complement what is already existing? Thank you.
Yeah, and for someone who is hearing
Yeah.
tonight about Hayo
Yeah.
or Hayo
Yeah.
Health,
Yeah.
can you explain to us in simple words, and what does Hayo Health do, and how can we access to the system or for the card system?
Yeah. Thank you so much for that question. In simple word, what we do at HayoHealth is we are building an AI software that actually automates that actually helps health facilities automate their claims,
Yeah.
reduce administrative errors that happens across the hospitals, the
The
insurance,
insurance,
the
yes.
pharmacy and everything, and detect fraudulent practices that always occur, and then securely share this patient's records.
Yeah.
All through the smart NFC
NFC
card.
card, yeah.
Now, to answer the question of how do you use NFC card?
NFC card, yeah,
Right.
exactly.
Yeah, to answer that question, it's very simple, and I won't go too deep. But for surface level, NFC card is called a near field communication, and it stands as a key to our system.
Okay.
A patient has their NFC card. Now, seamlessly, their records are able to be accessed by the health facilities, the hospitals, the clinics. At the same time, their claims identification and everything can be accessed. And there's an easy flow from them to the hospital, to the insurance, or to the pharmacy.
Yeah.
Like, everything is now connected in one system, in a good infrastructure, without fragmentation, ensuring interoperability.
Yeah, I heard you say that you're doing with AI to have the card system NFC. Yes?
Yeah.
Now, how do you prevent fraud, delayment of information, and data error?
All right, thank you very much. One of the ways that fraud happens is when it's through collusion.
Okay.
Right? When hospital colludes with an insured patient to help an uninsured patient.
Okay.
Or when an uninsured patient and insured patient comes together to, ensure that, drugs are being, or medication, or they are being attended to. And not only that, one of also the major ways, I won't go deep, but these are like, the surface level.
Yeah.
Another way is that when a hospital agree with the insurance company what's actually a drug or a medication cost, but because the hospital feel like, the person coming to them is an insured patient, the insurance can always pay any amount of money, the hospital would want to increase the fees of that particular insured patient, and that's actually fraud. And also, I also want to drop here that fraud really happens through network.
Yeah, exactly.
Exactly. So in that case, we are building a system or an infrastructure where we are able to detect the fraud that happens during the claims verification, during the collusion, and in order for us to do that, we're using the network that we are building in our infrastructure, and I won't go deep into that.
Yeah.
But that's like how we actually when our system sees and detects those fraud that happens, it sends it to the insurance, and they verify in real time. And that's all I would say for now. Thank you.
One of very interesting things about your solution is that it can still work even with a poor internet connectivities. Why was build an offline first system to so important from Africa systematically?
All right, thank you very much for that question. So when it comes to online connectivity, it was once a plan. It still would be a plan,
Okay.
but currently not the plan. What I mean is, for now, we are just strictly an AI cloud-based system.
Okay.
But yes, we once had the idea of, helping people in the rural areas get access to this information, the hospitals, the patient, in real time without connectivity. That's the plan, but it demands a lot. What we can do now is to ensure that everything is cloud-based.
I really understand. We have been talking more about how your health,
Yeah.
but when did Ayo build or come into life?
Thank you very much for that question again. HayoHealth came to life officially in September 2025, but initially it was an idea that we had in May 2020, in April, sorry,
Yeah.
in May 2025.
Okay.
But what we were doing was just strictly for pregnant women. It wasn't like really so correlating with what we are doing now.
Okay.
And we're like, okay, we need to actually make more deeper findings and understand who our customers were. And thanks to my school, like they organized a program that really helped us to really understand an incubation or accelerator program
Okay.
that really helped us to understand and really identify our problem very well. And then realize that what we are solving wasn't the main priority.
Okay.
It wasn't really important at that time.
Yes.
And then realize, the huge gap and the huge markets that building an infrastructure that we need to do, right? And then after everything, we now say, okay, we've figured this out. Then we started officially incorporated HayoHealth as a company in September 2025, and we began from there. Yeah.
Okay. Yes. You are building this while studying as a soft engineering at university, is leader, African leader university. Which challenge did you face?
It's a lot. Thank you very much for that question. So I'm studying the BSc, which is Bachelor's in Software Engineering.
Okay.
And I won't lie, it's not easy. It's not easy to study. It's not easy to still build. It's not easy to still get something to survive with while doing both of them.
Okay.
And sometimes I sleep 3 a.m. Even right now as I'm talking to you, I've not slept.
Sorry.
Yeah, thank you. So I would say that it hasn't been easy, but what keeps me going is the motivation and the passion behind it. And I would say for sure that it's not about the workload that comes with combining those things. I've understood what's the purpose I'm trying to fulfill.
Okay.
Right? And I'm working towards that. And one thing I would drop here is don't really look at the workload, because trust me, it gets better. Just what I would drop again is when for me, right, what has really helped me is the passion.
Yeah.
It doesn't make me sleep. I need to actually solve something that would really help people. So it's not about the workload, honestly, even though it's really stressful to combine. Thank you.
Now, as a young Nigerian woman building a startup in a healthcare sector here in Kigali, what have been the thought that challenge, doubt, or moment where you almost gave up?
Thank you so much. There are a lot. One, I'm very young, right? Talking to investors, talking to the necessary bodies I need to get to in order to get my product out. It's so hard because I feel like they won't listen to me. I feel like they feel like this guy is too young to handle such a huge problem.
Yes.
And another thing is I have this stereotype initially of, oh, I hope they are not biased.
Okay.
You understand? I
Yeah,
don't
I
know, but
do.
you
I
understand.
do.
Yeah. And it's a challenge I really struggled with. But thanks to having the right team. I don't know, I'm trying to remember the last part of the question, but what I would use to wrap this up is these are challenges I face. One, I'm not the nationality of this country, but I'm actually solving a problem that would
Exactly.
benefit Africa.
Yeah.
But we're starting in Rwanda first. So having the right team really helps a lot. And I have one of the best team, honestly. I'm more of a technical founder, and I have a co-founder who is way older than me.
Mm-hmm.
And she's a Rwandese and Burundian.
Okay.
She's been there helping, and it has really, helped the company.
Yeah.
She's very smart. And I
That's
also have another
great.
co-founder who is way older than us all.
Okay.
So it has really helped. But these are like challenges I face. I'm so young. I'm not the national. It's a struggle sometimes.
Mm-hmm.
And through her, it gives me that ease access to the necessary place where I feel so intimidated, right, about those challenges I face. So
Yeah. Now, as a young African founder, and I know that most of many people who are young trying to build something
yeah.
for the future, for our future,
Yeah.
what did you advise them?
Good question. I would advise I would advise them as if I'm starting again.
Okay.
Because I've been opportune to actually work on a startup back in 2022, but
Mm-hmm.
it actually failed. It didn't go well. There was no guidance, nothing.
Yeah.
I was way younger. I'm young, I'm growing, but I was way younger when I built that. So if I'm to advise again, I would say find something you're so passionate about. If you have a problem,
Exactly.
you should be very passionate about it, because
Yeah.
when there's no funding, when you feel like things are not working well, when you feel demotivated, that's actually what helps you to keep going.
Yeah, exactly.
And once you do that, make sure your passion is something that won't actually make you sleep, because once it's a passion that does not make you sleep, you want to actually build and execute fast. Right? It doesn't only just stay as an idea or in the ideation phase. And after that, go into the market to understand the people that are suffering from that problem.
Wow.
Understand the market, understand the margin, right? And when you're done with that, to understand that, you need to ask questions that would actually create leads. And what are those questions? Questions that would actually, generate feedbacks for you. What are those questions? Usability, feasibility,
Yeah.
and can it be used? Is it feasible?
Yes.
And one last thing, usable. Is it usable? Is it something people can use?
Exactly.
So that actually would help you know how to navigate or how to navigate feedbacks gotten from your potential customers. And then when you're done with the pilots with an MVP, you must not have a perfect MVP to get into the market. MVP would help you more with the feedbacks and what to improve on.
Yeah.
And once you're building an MVP, target the core, right?
Wow.
The core.
Yeah, exactly.
And then when you're done, my dear, just
Focus.
get the money.
Yeah.
Get the money.
Exactly.
Honestly.
Yeah.
Honestly.
I believe
Yeah.
and I hope that
Yeah.
in few years, I'm not giving you 5 or 10 years, I'm giving just less years so that everywhere we'll be using your system card.
That's the goal.
And everywhere. And I hope that this one will improve not only our record, medication record, but it will help also, especially for us or people who are foreigner, like what you face, to not having the same issue. Yeah.
Thank you very much. And I would also add that one thing, when you hear about HayoHealth, what you should know is HayoHealth is an interoperability system, which
Yeah.
means it's a system that ensures that it's a software that ensures that every systems are able to communicate together in
Yeah.
one
One
platform.
platform. We have been talking about HayoHealth, but I want to ask a question, a very important question. How can we get the cards, the HayoHealth cards, and also in case if some people want to
Yeah.
get in touch with you, how can we get you easily?
Thank you very much. Regarding the cards, we will definitely distribute the cards to the right channels
Yeah.
because the card works together with our software.
Mm-hmm.
And then the channels we distribute it to will definitely reach out to who their patient.
Mm-hmm.
And then how you reach out to us is through our social pages and then our email. And our social pages across LinkedIn, Twitter, which is X now, Facebook, Instagram. You just search on Hayo Health, and then on to email us info@hayohealth.com, and my own email goodluck@hayohealth.com.
Thank you so much for all those information, and I encourage you again, and I hope that we will be meeting for another time.
Sure.
Thank you so much for coming.
You're welcome. Thank you so much for having me.
Thank you for everyone. African doesn't need more hospital. It needs a system that works, a technology that connects, and young people bold enough to build the future for themselves. And I think maybe the future has already started. Kindly subscribe in our channel. Thank you. Ciao.